California has had a rough go at it for the last several months, and that trend of misfortune doesn't seem like it will be ending anytime soon. Between the raging fires and then heavy rains that followed quickly afterward which caused massive mudslides, the people in California can't seem to catch a break. Now, just a few weeks into the new year, this liberal state is facing more adversity that has already claimed the lives of 32 people, with that number only expected to climb higher in the next few weeks. The state of California seems to be taking all sorts of massive hits lately, and with 2018 just beginning, they are not off to a good start. The flu season has arrived, and just like the fires last summer, it has moved quickly, with many fearing that an epidemic is on the horizon. Recent reports show that 32 people have died from the flu in just the last 2 weeks, but what is concerning is that the number has increased by 50% than what they are used to seeing around this time of year. The California Department of Health has reported that for the first 14 weeks of this year's flu season, the total deaths of people younger than 65 who have passed away from the flu have spiked from 42 to 74, which compared to 1 death last year. Here is more from Breitbart. California provides weekly public health epidemic tracking through 72 enrolled Sentinel providers, physicians, nurse practitioners, and physician assistants, located in all 58 California counties. Any patients suffering a fever above 100 degrees Fahrenheit and with a cough and/or a sore throat are laboratory tested for both influenza and pneumonia. Of the 59,683 cases tested by Sentinels in California during the first 14 weeks of the 2017 to 2018 flu season, 13,834, or 23.2%, tested positive for influenzas. But the epidemic is accelerating. Of the 6,977 cases tested in the flu year's 14th week ending January 13th, there were 2,161, or 31%, that tested positive for influenza. The peak of the flu epidemic is not expected until the second week in February. That means the number of weekly cases could triple, and the peak number of deaths could be substantially higher. After its case peak, the flu epidemic will slowly decline until about August. The U.S. Centers for Disease Control and Prevention, CDC, reported that the influenza epidemic is now widespread in all 50 states. The proportion of Americans seeing their healthcare provider for influenza-like illnesses for the week ending January 13th was 6.3%, the highest percentage since the 2003 to 2004 season. The number of Americans hospitalized with flu per 100,000 has increased to 31.5 from to 22.7 the prior week. The CDC expects the 2017 to 2018 flu epidemic to be the most deadly since the 2009 to 2010 swine flu epidemic that killed 284,000 people worldwide and 657 Californians. What makes this year's flu potentially so deadly is that there are 3 subtype variations of the influenza strain, and 3 variations of the influenza B strain circulating. The most widely circulating flu strain, type A, subtype H3N2, is this year's most dangerous. Despite vaccination being a third as effective compared to prior years, and taking 2 weeks before it is effective, the CDPH website states it is not too late to get a vaccination. It is no question that when something like this occurs that strikes fear into parents, rushing off to get the flu vaccine seems like a reasonable option. However, many questions if the flu vaccine even works, considering that many people in the medical field have said that the flu shot is from the previous year's strand. Then, to add more speculation to the already hotly debated topic, recent reports show that the flu vaccine may cause more long-term damage than help, especially for women who are pregnant. According to recent reports published by the National Center for Biotechnology information in the journal _Vaccine, researchers found that the flu vaccine can cause a significant increase in inflammation in pregnant women. The consequence of this inflammation can increase the risk of preeclampsia that can lead to eclampsia, which causes life-threatening seizures in women when giving birth. Though the big pink elephant in the room that no one is discussing is why are we seeing such an uptick in the flu being contracted in a state that has the strictest vaccine laws on the books? Well, it could be that there are floods of illegal immigrants pouring over the California border that do not have the same hygienic practices as the Western world. In fact, in the city of San Francisco, there's an actual map to help pedestrians avoid piles of poop in the streets that are left by homeless people and illegal immigrants. So, maybe instead of focusing on making sure everyone is vaccinated, they should be enforcing better hygienic practices instead. However, what we are suggesting here is common sense practices, and as we know, the left does not do that at all. Follow us on Facebook at Freedom Daily.